I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.